All right, guys. Hey, guys. I'm Dr. Taylor Premer here with Winchester Spine and Sport, along with my amazing victim here, Dr. Lauren Jordan, also with Winchester Spine and Sport. So we collectively make up 2/3 of Gestalt education as well. So we're really excited. We have Michael Shacklock coming to the States August 2, 3, 4, and 5. There's a couple spots left if you really hurry.
Two spots.
Yeah, two spots.
Left.
So, but that's not the real reason we're here. We're lucky enough to be asked by Kyra to do a little guest blog here. So with Gestalt, what we're trying to accomplish is we're trying to mix multiple systems and figure out where they all fit. So I was lucky enough to take this course with Shacklock last year, and what I really took away with it is how, number one, how intricate the tests are, and then number two, how powerful of an audit tool they can be used for. So what I mean by an audit tool is that as a young doc, I'm always concerned, right? Am I actually doing something that's working? As the patient just fooling me, am I fooling the patient? So the nice thing with audits, objective audits, they tell us whether or not we're doing the right thing to these patients, okay? So number one, again, it's very intricate, so we'll kind of go over a median nerve tension test, and then I'm going to kind of intro how that could possibly play in as an audit for a disc derangement in the McKinsey model. Okay, so to start off, a median nerve tension test. So you've all seen this, but a couple things that are really, really important. Number one, doctor position. So one thing that Shacklock really stresses is being down at your patient's level. That way you can use your body to kind of manipulate their arm. So number two is what's really, really important that I've found is using your hand appropriately. So start off with a nice finger gun here, and you're basically going to grab their thumb and then wrap your thumb around the backside of the wrist. That allows you to extend the wrist or backwards, right? And allows you to get a little bit more stretch at the end of this test. So to start off, downwardly rotate the scapula and kind of stick it in place, and then you're going to assume the position here with your hand. From there, we're going to abduct the shoulder up just past 90 degrees. Then from there, we're going to start the motion. So external rotation of the shoulder until the plane of the ear, and then we're going to supinate the forearm, flex the wrist, and then start to downwardly pressure here. So what we're looking for is a positive response. I'm going to ask Lauren, are you starting to feel something? And then where do you feel it?
My fingers here.
So fingers are numb. So now what we're going to do is differentiate that movement. So I'm going to have her move her neck away from me. Does that make it worse?
Yes.
And then now move it towards me. Does that make it better?
Yes.
Do you feel anything when you come this way?
No.
So basically what that tells us is that this condition differentiated. So there might be something centrally mediated, in other words, something in her neck that's causing this. So why this is important as an audit, I think, is that now let's say that she comes in with neck pain. Maybe she's got a little symptom response into her shoulder blade or even down her arm. Now if I end range load Lauren's neck and come back to this audit, right, and do it again, just how I did it again, and now it got better, that gives me a very, very valuable hint that maybe I need to keep end range loading her neck to get rid of these peripheral symptoms. So even though her symptoms maybe aren't even in the hand at this point, we can reproduce those symptoms, show a positive response to the patient, and then use that patient visit to see if we're making a change, a long-lasting change. So I hope this is a little bit of insight and something that I've really taken away from not only Shacklock, but the doctors here at Winchester Spine and Sport, and how useful objective audits can be for you and your patient. So we hope to see you guys at a course soon. Hopefully we'll have a link below of all our upcoming courses. We really, really highly suggest you attending Shacklock's course, hear it from the horse's mouth, and then also find yourself to an MDT course because it's valuable information, especially when you kind of start to mix them all together.